It is my pleasure to welcome you to Victoria and to the H conference on behalf of the University of Victoria. We don't often get snow here in Victoria, so I hope that you're enjoying the specially arranged Canadian winter. I am Abdul Sari, the new director of the School of Health Information Science, for hosting this event. My colleagues from the school are also here. Let me introduce you Dr. Elizabeth Riotti, Dr. Alex Kerr, Dr. Andre Krushner, Dr. Francis Lau, and who many of you also know, Dennis Carty. We'll look forward to meeting you, many of you, over the next few days, finding out more about you and what you do in e-health, and to exploring opportunities to work together. Let me set the scene here. In the developing world, I believe we have good knowledge, good technology, and expertise in health informatics, but I feel that the implementation and adoptions of the new technology has been relatively slow. With that in mind, I think the key questions for the next few days are: what is the state of electronic advancement in health? What can we do to accelerate the progress to date? What can be done to speed up innovations and implementation of new technology? This conference brings together academics and professionals from health informatics around the world. The conference content demonstrates, I think, the significant contributions that everyone is making in advancing health informatics. Through our keynote speakers, presentation, workshop, and poster display, we have great opportunity to learn from other countries, to share our own best practice with others facing similar problems or seeking to capitalize on opportunities, and to encourage our students as the future of our discipline. I hope that you enjoy the conference. I urge you to fully contribute over the next few days. Let's energize health informatics and put it where it rightly belongs, on the international stage. Thank you. I'm now delighted to introduce Dr. Mary Ellen Perkis, which I usually call her boss. Mary Ellen is the Dean of Faculty of Human Social Development at University of Victoria and has been a great supporter of health informatics and public health for many, many years. I would like to thank her for her continuous support and her promotion of this conference. Mary Ellen is going to welcome you all to the conference and to introduce our keynote speaker. Boss.
Always with the greatest of respect. Abdul calls me that. So I'm very pleased to be here. This is at least the second time, I was trying to think, maybe even the third time that I've had the opportunity to welcome participants at this excellent conference, this, as I understand it, relatively unique conference, and I wish I could welcome you to a much more sort of flowery Victoria. This weather that we've had here over the last few days. I'm sure you've heard this is highly unusual for us. We're all sort of a little skitterish on the ice and the snow. We don't do snow here on the west coast of Canada. So we have a beautiful sunny day there today. I understand from the forecast it's supposed to get a little bit nicer, a little bit warmer. It'll probably get slushy and it'll probably start raining, but we'll all be much more comfortable with that. So I bring you greetings from the university as well as from the Faculty of Human and Social Development. And I would like to just begin the meeting here today with this international audience that we have by acknowledging with respect that we are meeting here on the traditional territories of the Coast and Strait Salish people, who were the first people of this land. And indeed, just across the harbor there is a very traditional territory where they would come in the summertime to have feasts and play and work together on the shores of this lovely harbor that we now live and work on ourselves. I am Dean of the Faculty, and I am a proud leader of 6 professional schools and home of some very innovative interdisciplinary graduate programs. In the faculty, we have the School of Nursing, Social Work, Public Administration, Child and Youth Care, of course the School of Health Information Science, and a brand new School of Public Health and Social Policy. And given a little bit of what I know of our guest speaker this morning, that seems particularly apropos with the combination of those last 2 schools. In coming here today and thinking back on my own career, I'm a faculty member in the School of Nursing. I graduated with my undergraduate degree in nursing from the Faculty of Nursing at the University of Calgary. And one of the faculty members that I met there and had longer associations with probably than any other faculty member in an odd sort of way is Dr. Kathy Hanna, and many of you may know of Kathy. She was a very strong and early advocate of health information systems, and certainly introduced all of us at a time when, I mean, computers were those massive things that took up rooms and rooms of display, and I contemplate coming down here this morning with my iPod and my iPad and my Air, and I'm carrying it all with me everywhere I go, and so things have certainly changed. You've been here, of course, all along, and the rest of us are somewhat slow to catch up, especially those of us who are practitioners, and I think this is partly what Abdul was speaking of, the rate of change and implementation of some of the excellent innovations that you and your colleagues bring, I think certainly do need to be moved along. We have great opportunities to affect patient safety, care planning initiatives, and I think just opportunities to enhance professional practice altogether. And so I encourage you and look forward to hearing the outcomes of your meetings here on those fronts. The School of Health Information Science has a long and very proud history, long associations with renowned contributors to this field, people like Jochen Moore and Dennis Proddy, who I see here in the audience today, and James Coward. This morning's lecture is dedicated to James Coward, who is a very active local advocate for this program. He was coordinator for co-op studies in the school, as well as being a co-op employer. And indeed, he was chair of this particular conference at the time of his untimely death. In 2011, we're gathered now for the 11th meeting of this group, and I have been given the honor of introducing to you Dr. Sally Stansfield, who's been invited to give the James Coward lecture on this opening morning of your conference. Dr. Stansfield is the Executive Secretary of the Health Metrics Network, an innovative global partnership that's hosted by the World Health Organization in Geneva. As the founding director of this initiative, Dr. Stansfield works to improve health and save lives by strengthening and aligning health information systems around the world. With her leadership, the HMN Secretariat coordinates the efforts of member countries, technical agencies, donors, and civil society groups that are committed to improving the availability and use of information for decision-making. Dr. Stansfield is an expert in public health and development of health information systems. She's worked extensively in the field in Africa, Asia, Central and South America, and in the Middle East. For 7 years prior to assuming the leadership of the HMN, she worked in the Global Health Program for the Bill and Melinda Gates Foundation. There, she was instrumental in creating and managing several landmark alliances, including the Global Alliance for Vaccines and Immunization, the Global Fund to Fight Tuberculosis, AIDS, and Malaria, and the Global Alliance for Improved Nutrition. Dr. Stansfield has served in research and teaching roles on the faculties of Addis Ababa University in Ethiopia, McGill University in Montreal, Johns Hopkins University in Baltimore, the University of Washington in Seattle, and the Uniformed Services University of the Health Sciences in Bethesda, Maryland. We are very pleased that she's able to be with us here today in snowy Victoria. Ladies and gentlemen, let me introduce Dr. Sally Stansfield. Sure, why? I'm happy for everybody to come.
Well, good morning. It is indeed a pleasure to be here. It'd be more of a pleasure when I find out how to pull up the slide. Yes, you may. My God. God bless. after that smooth start, I have to say it's a privilege to be here. Victoria, I used to live here, but I do love this place, and it's particularly spectacular today. I think it's really showing its colors. It's beautiful, but it is indeed unusual, this snow. But it's beautiful. And as I look out the window, they're very nice to we guest speakers. I've got one of the view rooms. Yeah, I have to admit it was a little hard to focus on resource poor settings, but I worked on it. So let me just say that I am delighted to be here as to give this James Coward lecture, and but I look forward in particular to, I hope, getting a bit of a provocative start to the discussions here, and following up over the next couple of days with this very exciting group that's here. So I'll talk a little bit about the current status of information systems in the developing world, just to set the scene. A little bit about how the game may be changing, or could be, or should be changed, and a bit of a vision for how global health can transform health outcomes. And then get philosophical about the information community, the informatics community, and what it could and should do. So first, a little bit about supply and demand. I love to show this photograph to my students, just because I think it focuses the mind as you tell students that there are, your job is to manage health for this community. How are you going to start? And of course, there's only one right answer for those of us who care about information, and it's find out who's out there. It's manage the information. I think it makes it pretty clear. But sadly enough, those with the biggest need for information are those with the rottenest systems. But I think the flip side of this is the good news, namely that it is in these places where getting good information and managing it well can make the biggest difference. So, which is why we love working in these settings. Let's not talk too much about health records. You guys know more about this than I do. It's mostly these little exercise books in the places we go in the developing world, and it's pretty hard to put that together and pull those out of the piles. This is data aggregation at the level of the pile in the developing world. I've seen worse. I've got a couple of really good photographs that I couldn't find, but oh dear. It's pretty hard to imagine how you're going to extract the potential benefit for either individual health or public health out of these things. And we make it worse, we at the global level, by requiring reporting about things that are perhaps least relevant for managing local systems. So the profusion of indicators that are often required by the special interest groups from individual diseases don't really help. And meanwhile, the pressure's increased on these poor developing countries with the Millennium Development Goals, reporting on those. The World Bank and the regional development banks have recently decided that we're going to do performance-based release of funding. We're going to really get tough. That sort of sends people spinning in the developing world. And then furthermore, my favorite is the recent discussion, which of course we've all heard about, the importance of country ownership. Nobody will really say what that is, but if you don't own the data, it's pretty hard to own the country. That said, it's not all bad news. Certainly most countries have a census. The census, I think for the likes of us who work on the health sector, is a very important resource, sampling frame for what we do, but the reality is the health sector doesn't control the census. It rarely even feeds into shaping the questions.